Water and Global Health, next on International Focus.
The Institute of World Affairs at UWM and Milwaukee Public Television present International Focus, a global magazine linking Wisconsin and the world.
Welcome to International Focus. I'm Doug Savage, Assistant Director of the Institute of World Affairs at UWM. World Health Organization studies reveal that over 1 billion people worldwide lack access to improved drinking water. Lack of safe water, combined with inadequate sanitation, is the overwhelming contributor to an estimated 1.8 billion deaths annually due to diarrheal disease. The vast majority of the victims are children under the age of 5. Rapid urbanization is exacerbating these challenges, creating life-threatening slum conditions in which the urban poor find themselves worse off than their rural counterparts. To help us explore this growing global water crisis and some innovative solutions to address it, we're pleased to be joined by Katherine Bliss, Deputy Director and Senior Fellow of the Americas Program at the Center for Strategic and International Studies. She is also a Fellow at the Global Health Policy Center. Previously, she served as a Foreign Affairs Officer at the U.S. Department of State, where she focused on global health and the Western Hemisphere. Katherine Bliss, welcome to International Focus.
Thank you. It's nice to be here.
Well, I wonder if we could start by just sort of framing this notion of a global water crisis. I mean, what makes it a crisis?
Well, there are a couple of things that are contributing to a sense of urgency with respect to delivering safe drinking water to people. You know, on the one hand, in 2000, the nations, the member countries of the United Nations, gathered together and agreed to the Millennium Development Goals. One of those goals is to ensure environmental sustainability, and one of the targets within that is to reduce by half the proportion of people in the world without access to water or sanitation. Right now, as you mentioned, there are nearly 1 billion people who don't have access to safe drinking water, and there are significantly more people who don't have access to any kind of sanitation whatsoever. These are challenges primarily in the developing countries, in sub-Saharan Africa and in Asia. But these are issues that the world has faced for over a century. In many of the developed countries, governments and communities have developed solutions to deliver safe drinking water and to provide the kind of sanitation services that are needed. So the challenge and the crisis is ensuring that those same services reach the rest of the world's population.
Well, there are sort of two elements, I would think, to a crisis like this, quantity and quality. So what is the sort of ratio of those kinds of aspects of this crisis?
Well, it's true. I mean, a lot of times when people talk about water challenges, you have quantity, quality, and availability. And one of the problems with water quantity or water availability is the fact that many communities are not necessarily situated, many communities do not have piped access as we enjoy here in the United States. And so in many parts of the world, communities are situated quite a distance away from a river or from a well from which they can draw water. So in that context, family members, often women and girls, children, are the ones who have to walk several hours a day to gather water and bring that home to make the water available for the household. So that's an access issue. It's, in many cases, they may have to compete with other communities for access to that water source. So that's a quantity issue as well. The quality problem is the fact that even when people have access to, whether it's surface drinking water or groundwater, or when they have a tap that's either in their community or when they have a pipe coming into their home, it may be labeled an improved drinking water source because it's nearby and because they have water flowing out of it, but it's not necessarily safe for them to drink. And so in that context, treatment of the water and ensuring that it is treated and properly stored at the household level is also important.
And I think for many people, sort of lack of access to water evokes images of sort of a very thirsty village out in the middle of some very remote territory. But talk a little bit, if you would, about sort of the urban aspects of the problem.
Well, as you know, I mean, one of the trends in the last decades is, the fact that the world has become an urban place. Many of the countries in the Americas are urban, and increasingly we see not only mega cities, like these huge cities with 20 million, 25 million people, maybe not that many, but 20 million anyway, but also smaller cities, 1 million people or even less, but, that not only have a growing urban population that is, increasing on its own, but also, with migration from rural areas or from other cities to urban areas themselves. While established cities and established neighborhoods and established cities may be able to count on access to a piped supply and to sanitation, many of the slums and informal settlements, which is where the migrants either from rural areas or from cities come, don't have that kind of access. And so, what you see are situations where if they have a piped supply, it may be, it either has challenges with respect to maintenance, so that the pipes are open and the water becomes contaminated, or they don't have any kind of access at all, and so they're reliant on tanker trucks that may drive through and charge higher prices than some of the other neighborhoods in the city might charge for the public services, so that people can line up at the tanker, fill up a container with water of perhaps dubious quality, and then take that home and store it, almost perhaps as if they were still in some of their rural communities.
Well, one of the things that we associate, obviously, with these kinds of challenges is just sort of the biochemistry of it. If you eat or drink bad water, you'll get sick. But there's sort of bigger societal issues involving sort of the perpetuation of that cycle of poverty and lack of access to water, aren't there?
Well, I mean, certainly the fact that 884 million people don't have access to water and nearly 2.5 billion people don't have access to sanitation leads to significant morbidity and mortality. I think earlier you mentioned that many of the deaths are among children, and there are statistics that say that 4,000 to 5,000 children each day die from water-related disease. And in addition to the mortality, just the missed economic and the economic and opportunity costs are significant. About, I think, school children miss on the order of 300 million school days per year because they're sick and have to stay home because they have diarrhea or some other water-related illness. At the same time, adults miss, I think the number is about 320 million productive work days each year. And whether that's because they're sick or whether that's because someone has had to stay home to take care of another family member or to take care of a sick child means that people who are might otherwise be able to enjoy educational opportunities or income generating opportunities are instead because of water-related disease having to forego that kind of productivity.
Well, and we touched on this a bit earlier, but some of those impacts can be disproportionately borne by women, can't they? And how does that work exactly?
That's true. I mean, on the one hand, when, in many cultures around the world, women are more commonly associated with household work and with the upkeep of the family, with the kind of reproductive tasks of the household. And so when children are sick and have to stay home from school, it is frequently the mother who stays home with the child to, ensure that they are taken care of and that they become better. Takes the child to the doctor if there is a doctor available and seeks care for the child. By the same token, if those mothers or other women in the household were engaged in any kind of vending or other kind of entrepreneurial activities, they've had to forego that for the day in addition to, kind of taking time away from their regular household chores to take care of the child. At the same time, in many countries, estimates are that women walk up to 10 miles a day or spend up to 6 hours a day going to gather water. And this, is something that, is not only a burden in terms of the time that it takes away, but nobody wants to walk back and forth to do that several times. So people are carrying quite large containers that they then try to fill up. And that creates physical stress, as well on women who are, otherwise spending considerable amount of time and, working to juggle a number of household responsibilities and really carrying this weight either on their heads or through their arms.
Well, I'd like to talk a little bit about sort of the possible solutions to address some of these issues that we've talked about. Mm-hmm. But I'd like to have your thoughts on whether or not there's been sort of a more fundamental shift in the perceptions of water in some circles. I mean, some people talk about, you know, the commodification of water versus water as a human right. Do you think that's changed in the last decade or so?
Well, over the last, I'd say 3 decades, maybe more, there have been a number of sort of decades, UN designated, United Nations designated, focused decades on water. Between 1980 and 1990 was drinking water and sanitation decade. And then I think right now, we're in the midst of the International Decade for Action, Water for Life. So, these are 2 kind of 10-year long periods that the international community has come together and said, we need to set targets and focus attention on really bringing drinking water and sanitation to the most vulnerable populations. But by the same token, I think even here in the United States, we're starting to see a lot more advocacy around water, and water as a global health issue, water as an environmental issue, water as a security issue. There's been a lot of focus over the last 10 or more years. In 2005, Congress passed and President Bush at the time signed the Senator Paul Simon Water for the Poor Act, which made dealing with water issues an aspect of U.S. foreign policy. And over the past few years, Congress has appropriated funds specifically for that focusing on sub-Saharan Africa, but also other areas. And even within civil society organizations in the United States, there's been increasing awareness of the links between water and health, and increasing advocacy with Congress, with at the popular level and with the UN, to focus attention on water and sanitation challenges.
Well, and in some scenarios where particularly there's a private sector component to the delivery of water services, I think we see very often one of the aspects that's really highlighted is that water has value in a commercial sense. And one of the criticisms of some of the earlier publicly funded systems is that wasn't taken into account. I mean, how does this play into all of that?
There have been a number of, incidents or issues over the past couple of decades that have highlighted, the challenges around the value of water itself. And, some people talk about, the importance of creating sort of a culture of water, so that people, kind of understand what water means in their particular culture, in their community, and can, sort of assign it, perhaps an abstract value, but, not take it for granted per se. Then there are, sort of the more specific cases where water may have, in a particular context, let's take Bolivia in the late 90s and in the early parts of this decade, where a decision was made to move from a publicly organized water source to a privately organized water source. And the idea was that private company might come in and make some investments that would improve maintenance for the system, but the private company also began to charge consumers for water prices. And in the city of Cochabamba in Bolivia, this led to considerable dissent and tension in 1999, and then again in La Paz and other areas in the early parts of this decade. So I don't know that that's an issue that's been, resolved sort of at the global level, but there is lots of discussion around, finding a way to ensure that funds are available for the maintenance and for the extension of systems, and yet at the same time make water available at a reasonable price for the most vulnerable populations in a way that they can afford it. Well,
and we're going to take a short break, but when we come back, I'd like to talk a little bit about some of the models for doing just that. To our viewers, we'll be right back on International Focus.
The Institute of World Affairs presents our community with a range of public programs relating to global issues, U.S. foreign policy, and the world economy. For more information about the Institute of World Affairs, call 414-229-3220 or visit our website at www.iwa.uwm.edu.
Welcome back to International Focus. We're talking with Katherine Bliss from the Global Health Policy Center about water and health. Well, we touched a little bit upon some of the various models for delivering clean water, and I guess we'd start with a fundamental question: whose job is it to provide water to the population?
Well, this actually causes some amount of confusion within communities themselves. Water, the outcome of drinking bad water or unsafe drinking water is ill health. And so sometimes people point to the Ministry of Health and say, well, it's the public health department's, role. The public health department may say, we don't have the resources and we didn't build the supply, so it's public works. Some countries have ministries of water that manage water issues, but perhaps they're looking at agriculture and industry, which take up the lion's share of drinking water. Take up the lion's share of water for productive purposes. And so ensuring water quality is really something that involves a variety of different partners. And those are partners at the government level, at the level of the private sector, and within the community, civil society organizations, neighborhood associations, and household members.
So what about if we take our own country as an example? Who really has responsibility for water and who should within the U.S.?
Well, at the national level, we have legislation that ensures clean drinking water and safe drinking water, or that mandates that at the national level in the United States. One of the interesting things that happened in the U.S., I guess back in the 1970s, was with the creation of the Environmental Protection Agency, which oversees the implementation of that legislation. It was that the environmental protection or environmental health sector became kind of divided from the public health sector itself. And so, I think sometimes, these discussions also take shape at the community level in the United States, where water decisions are organized. And it really involves a discussion among utilities, departments of public health, environmental protection agencies. And of course, it underscores the importance of civil society groups and neighborhood associations in, advocating for attention to those issues, ensuring that legislation is being applied and advocating for improvements when they're needed.
Well, you mentioned Cochabamba and some of those issues, and ultimately that contract was set aside, was it not? And so there was a private sector company that was given the contract, and in the face of this huge uprising, that the contract was actually set aside. So I'm wondering, what are some good models around the world where there's a public sector system for delivering water that's not being adequately resourced and really can't do their job, and versus the private sector who could make the investment but with the expectation of a return on that investment? I mean, there are places where that sort of public-private equation has been balanced?
Well, it's interesting, actually. In the Americas, there have been a number of initiatives over let's say, the past 4 or 5 years that are really trying to bring together these multiple stakeholders to develop methods for thinking about, identifying the vulnerabilities in water systems, identifying the priorities of the community in terms of undertaking remedial action, and then, really working to find funding for those remedial activities and charting a plan for future action. And I guess a number of years ago, the World Health Organization kind of conceptualized a set of practices that are actually based on the food industry's hazard analysis and critical control point, or the HACCP principles, which seek to identify vulnerabilities in a water system from the watershed all the way to the consumer. And they call this a water safety plan. And it's really, sort of a method or an analytical process for identifying, where those vulnerabilities are, and then working with the community to identify priorities and solutions. And so, this is something that, has been certainly introduced through the International Water Association and other groups around the world, but it really seems to have taken hold in the Americas, where the Pan American Health Organization, the International Water Association, the Inter-American Association of Sanitary Engineers, a number of private sector companies, universities, and donor agencies, and technical agencies from donor countries have come together to work in, I think, Jamaica, Brazil, Bolivia, Guyana, and a number of other countries, at the community level to pilot some of these projects and demonstrate the efficacy for, really bringing all these different sectors together to come up with solutions. But it's not easy. I mean, it takes several years. Basically the idea of the plan has to be introduced. It's a rigorous analytical method for kind of going through every step, within the system, and then, of course, raising the funds, which can often be expensive for maintenance or for extension of services, may take a long time, but it allows the community, and including civil society actors to come together and say what their needs and interests are, and then, identify a future plan for action.
Well, and that brings up an issue in so many development kinds of situations. For the wealthy countries, the donor countries, it's much easier to act at a national level, but it's often less effective. So how does that really translate in terms of really affecting at the individual level access to water? I mean, what do a well-intentioned outside donor agency, how can they get to the tap in the village?
There are a number of different processes at work, I think. And, on the one hand, the international community meets through the United Nations, through World Water Fora. There was just one this past year in March in Istanbul, through yearly meetings and the like, to kind of discuss water policy writ large and to convene to assess, the data that's been collected and to understand, problems from the regional level all the way down to the individual level. Some donor governments do provide budget support to host government agencies to facilitate their planning or their thinking on water-related activities. But a lot of action also, takes shape through local NGOs that are working at the community level to deliver perhaps household level services such as filtration, ceramic filters, biosand filters, to teach about the methods and hygiene practices associated with solar disinfection, chlorine tablets, chlorine drops, and the like, that are solutions that people at the household level can sort of take into their own hands to protect the water that they gather and to safely store it, but which also afford opportunities for the production or the generation or manufacture of those products at the local level, and can afford sort of sustainable entrepreneurial opportunities as well for people in the communities to sell those products and to earn a living and thereby make it sustainable at the same time. So, from high-level policy discussions, all the way to very specific programs that, donor governments can fund in conjunction with professional associations, with international organizations, and in partnership with local communities.
So we've talked a little bit about sort of the multilateral institutions. So what is the U.S. doing in this field?
The U.S. is involved in, sort of water diplomacy and water activities, again, at a variety of different levels, by participating in discussions at the United Nations, through the Commission on Sustainable Development, through the World Health Organization, and through others. The United States, through the United States Agency for International Development, allocates funds to support water-related activities, some under the Senator Paul Simon Water for the Poor Act, but also just under existing programs relating to climate change, biodiversity, agriculture, and other aspects. USAID and the Centers for Disease Control and Prevention, based in Atlanta, work closely with the World Health Organization and a network through the WHO, which is called the International Network, to promote household water treatment and safe storage, to research and kind of develop the case for using those kinds of what are sometimes called point-of-use interventions, and also developing programs in conjunction with international NGOs and civil society organizations based, at the local level, to introduce them, to provide education, around them, and to, ensure that they can be sustainably developed through, reliance on locally made products, and, that they can be marketed and sold at the local level as well. So
we've got probably just about a minute left. So all that notwithstanding, if tomorrow you get the call from the White House and you're the water czar, anything you do differently?
I think that water challenges can seem daunting. The financial, commitment alone, is not something that can, be resolved by one government or, by one sector. So promoting greater dialogue and partnerships by seeking to understand from communities themselves what the challenges are and how they see, their involvement in some of the solutions. And, I think one thing that's really important is, the United States has a considerable global health, capacity, a number of programs with respect to global health, and leveraging those to, whether it's the HIV/AIDS programs, malaria programs, tuberculosis programs, or others, but using those to, build water and sanitation programs into those, ensuring that every AIDS program also includes a water component where healthcare providers have water to wash their hands, patients have water to take their medications, and the clinic that is being supported with U.S. funds has a toilet or a latrine or something to promote sanitation is a positive way to start.
Okay, well, we're going to have to leave it there. To our viewers who are blessed with plenty of fresh water, we'll see you next time on International Focus.
For information about the Institute of World Affairs and its many programs, or to become a member of the Institute, call 414-229-3220 or visit us at our website.